Welcome back, listeners, to Mosaic's Community Life podcast, Life in Canada. Thank you for taking the time to listen to our podcast today. My name is Jane Teasdale, and I'm one of the co-owners of Mosaic Home Care and Community Resource Centre in Toronto. Our organization focuses on person-centered care, community, and social connection. I would like to welcome today Adrienne Tuffin from the Good Companion Senior Centre in Ottawa. Adrienne is the Manager of Resource Development for the Senior Centre Without Walls Partnership Program. Hi, Adrienne.
Hi, Jane. Thanks for having me.
And it's a beautiful day. I think we were just discussing about the weather. The sun is shining in Toronto and the sun is shining in Ottawa. So it's lovely. And I love the greenery that you have behind you. It looks amazing. Before we begin, I will provide a brief bio on Adrienne. Adrienne's kinship with older adults began in childhood, as she was largely raised by her grandparents. She has many fond memories of planting trees with her grandpa, taking long walks to clean up the neighborhood with her grandma, and entertaining them endlessly with her theatrical antics. As a grown-up, she became a passionate advocate for older adults while working as a personal support worker in long-term care, hospital, and community settings. Outside of her work, Adrienne enjoys curling, singing, sea shanties, and cycling. So thank you. Very interesting. And I loved how you spoke about your grandparents as well, and certainly cleaning up the neighborhood and going for long walks. So, I can certainly see that you're passionate for what you do within your work.
Thank you, Jane.
I just want to provide some information from the Age UK on loneliness. I always like to bring, some sort of academic work when I'm discussing things. And according to Age UK, loneliness is one of the top 3 concerns of older adults. Attention to social isolation is as important as meeting functional needs. What might appear insignificant to a care provider might be deeply significant to the service user and their family, and personal dignity is affected profoundly by the ways in which members of staff behave towards older people. Being lonely has a significant and lasting effect on blood pressure, is also associated with depression and higher rates of mortality. Influence of social relationships comparable with smoking and alcohol consumption, and to exceed the influence of physical activity and obesity. There have been several articles, presentations, and research done on loneliness even before COVID-19. Loneliness is an issue worldwide that we are facing, and nice to know there are organizations that are filling the need to provide social engagement and connection in Canada and around the world. And Adrienne, do you have any additional stats you'd like to share about loneliness?
Yes, thank you, Jane. Yes, I thought I would start by actually defining what we mean by loneliness versus social isolation. So loneliness is that subjective feelings of being lonely, whereas isolation is actually the few or infrequent social connections. And I like to say that because we can still feel lonely even if we aren't technically isolated, even if we are surrounded by a network of friends and family. And it's just really important to normalize that feeling and really destigmatize that. So I wanted to mention that first off. Additionally, like you mentioned, the lasting effects of social isolation and loneliness on health are astounding. In the 2022 National Institute on Aging report, we saw that it led to a 25% increased risk of cancer mortality, 50% increased risk of developing dementia, 59% increased risk of functional decline, and ultimately a 45% increased risk of death. So in response to some of these, the awareness of the impact of loneliness and isolation on health, we've seen different global movements. The UN, for example, we're currently living in the UN Decade on Healthy Aging, which is 2021 to 2030. And that aims to give everyone the opportunity to add life to years wherever they live, and really places older adults at the center. We've also seen a rise of age-friendly communities. And of course, like I'm here to talk about today, Senior Centre Without Walls.
Adrienne, what does Senior Centre Without Walls exactly? Can you explain it a little bit?
Yes, thank you, Jane. Yes, so Senior Center Without Walls, or I'll refer to it as Without Walls throughout our podcast here, it is a social program for older adults, and it happens entirely over the phone. So essentially what happens is a facilitator will host a group of seniors over the phone, similar like a conference call, for example. So it allows participants to enjoy connecting with each other from the comfort of their home and enjoy a range of programming, which I know we'll get into a little later. And so typically we do define older adults as those 55 plus, and it's an entirely free program. And the only thing you need to participate is a phone. And of course, you can attend as many sessions as you'd like.
So we're going back to the old-fashioned way of picking up the phone and having conversations instead of people using their iPads, their telephone or going online for Zoom. Not everybody has access or, is able to pay the fees each month to have internet. And can you tell us a little bit, like, how did this get started, the history and how it came about?
Yeah, thanks. So yes, as Without Walls was actually first coined in 1989 by Dorrit University in New York, and they run a program called University Without Walls, and it's actually still thriving to this day. So from there, it expanded across North America, and in 2009, we saw our very first program in Canada, which was in Manitoba. So yay, Manitoba, pioneers.
That's
And for us at the Good Companions in Ottawa, my colleague Carolyn Calder actually became inspired when she was working to create a program specifically for seniors who are isolated. And in creating that program, she encountered many challenges. Challenges like they weren't able to attend in-person programming. They weren't able to attend things virtually, like you said, about the barriers with that. And so she started to offer some phone programming and had those one-on-one calls, but she felt it didn't create space to connect with other people and build that more organic friendship.
that relationship building, yes. Yeah.
Exactly. So she went down the research rabbit hole that I'm sure we're all familiar with. And in doing so, she came across the New York program, University Without Walls, and a California program as well. And of course, our Canadian pioneers in
Yes.
Manitoba.
Well,
And she said, quote, she knew the idea was pure gold and advocated for our creation of the program, which started in 2015.
so Adrienne, what kinds of topics and programs and discussions do you feature on your telephone program?
Yes. So one of our partners, Perth Enrichment Program, they offer a social dining program. So they have all of their participants receive a hot meal, and then afterwards they all hop on the phone and eat together. So that's really special.
I think that's
Uh,
so nice, so they're
yeah,
having that conversation. And then they're sort of breaking bread together as, they're eating in discussion. I think that's so lovely.
exactly. And especially if maybe there's folks that live alone, eating can be really lonely. And it
Yeah.
is something that in our society is meant to be very social.
Yes.
So having that opportunity is wonderful. Our friends over at Rexdale Community Health Center actually do a choir over the phone. So typically they will have one person singing at a time, but they also encourage folks to prepare a song to share with the group. And so that may be something in their own native language or culture, and that's a lovely sharing opportunity. I've also seen a lot of popularity with discussion-based programs. So that's really nice because the conversation kind of naturally and organically flows. And it's kind of like wherever the day takes you, or wherever that story or reminiscing takes you, can really reveal a lot about who's on that phone. Additional programs are meditation, for example. Laughter yoga is very
Nice.
popular. And we always feature guest speakers, whether it's doctors, pharmacists, nutritionists, environmentalists, so on and so forth. You name it, and we've likely done it on the phone program.
No, that's great. And just if I can ask another question, the facilitator who's facilitating it, is there, does she obviously know who's coming online, but is there a document that they would fill out on their sort of interests and hobbies or what they're interested in? So then, a format or a program can be developed, or maybe you can talk a little bit about that.
Yeah, absolutely. It's a great question. Thank you, Jane. So what we found in offering this program is there's definitely that initial hesitancy. What do you mean we're going to do a program over the phone? How can that possibly work? So we always advise that those first initial calls where you're talking about the program with that older adult, it's very much to gauge what their interests are and to just initially build that relationship and buy-in to at least just try the program. And we found a lot of success too in making it clear that they're not obligated to attend. So we try to get them on a program that that we're facilitating, because of course we've now built that connection with them. And after that call, we're going to follow up with them and see what they liked about it, or would they come back? What would they like to see if they came back?
Yeah.
And so we're going to really build that connection slow and steady. And then when we have that full buy-in, that's when we'll do maybe a more fulsome intake, where we're going to gather more maybe medical background. Do they live alone? Do they not? Any other things that are helpful to know about them, including, that fulsome interests and hobbies. But yes, it's very much critical to building that relationship.
Yeah, and it takes time. I mean, you may not gather that information on the start of the program, but as the facilitator gets used to that individual and they feel that that individual can open up a little bit online, then, and I guess, feedback and surveys, is that something that you do? So yeah, we find that's
Absolutely.
helpful with Mosaic. Is
Yeah.
always understanding. So, they're able to respond and say, oh, I like this program. How about we try this program? So we're always, within our team, we're always sort of revamping and changing things each quarter. So,
So
yeah.
critical. I know our local program in Ottawa, based out of the Good Companions, they actually offer program planning sessions with their
Oh,
participants quarterly.
that
And they
is a great
say,
idea.
here's what we're planning for the next upcoming
Yes.
calendar. Does it resonate with you, and what else might
That's a good idea, because it's not always about what the facilitator likes. They need to really be in tune with their participants. That is a wonderful idea. So it's sort of putting it out to those people because they're the ones that are wanting to come to the program. So try and make it that it's, a program for everyone. No, that's amazing, I think. And, it does take people to think, I think, I attend a lot of online programs, and as I mentioned, like the International Federation on Aging. And it's just so nice to hear people from other parts of the world and they're brainstorming and ideas for running programs, so, whatever topic or whatever program they've developed might work somewhere else. You may have to retweak it, but it's just nice. I think we're always learning and always wanting to brainstorm and definitely think outside the box. So it does sound like a wonderful program. So Adrienne, now what is your organization up to and what's coming down the pipe?
Thank you. Yes. So of course, we all know the global pandemic hit, and that prevented us from reaching out and connecting with our members and our clients. So of course, since we had been already running such a program that operated entirely virtually, we were very well poised to begin training other organizations in the Ottawa region to offer such a program. And then of course, we realized, oh, we're quite good at this. So in the fall of 2021, we received an anonymous donation to actually expand that program. And so from that, the SCWW, or Without Walls Partnership Program, was born. And so we are essentially a dedicated team that takes that model of Senior Centre Without Walls and expands it across Canada, specifically focusing on Ontario and the Atlantic provinces. And essentially, we support other organizations to create a program in their community. So different ways we do that is offering an annual microgrant of $4,000. We have a vast multilingual resource library with program content, marketing templates, and training resources. I also host a weekly telephone tapestry call that participants can call into as well. So that's lots of fun. And we also always host lots of capacity building events. And of course, you have access to our wonderful team full of incredible and intelligent women that are dedicated to seeing you succeed.
So really, SCWW, I mean, you've created that process and framework that works. And I guess, you're sort of guiding and teaching other organizations and definitely how they can put that type of program in place. Can you tell us more about the organizations that have implemented a telephone program?
Yeah, absolutely. So to date, we have partnered with over 90 organizations across
Wow,
Ontario
that's
and
amazing.
Atlantic
That's
Canada.
great.
Yeah.
It's a much needed program, that's for sure.
Absolutely. So yes, so over 90 organizations that provide senior centers at Walls in their communities. And actually, we have a full map of those organizations on our website, which we'll give you a link to in a moment. And, our partners certainly come in all shapes and sizes. Many are those senior active living centers, but we also have several municipal governments and even some partners that are entirely volunteer led and grassroots. So
Oh, that's
we have
amazing.
them all.
And people, I think they're interested in new programs and people are interested in participating in these type of programs because they see that they're beneficial within our communities. So how would an individual find out more about your programs and who would they contact?
Perfect. Yes. So we certainly have a website that you can go to. So the link is tinyurl.com/SCWW partnership. Like I said, that has a link to our full map of SCWWs or Without Walls programs. And feel free to reach out to us over email too. So that email address is scwwconnect@thegoodcompanions.ca.
Thank you for that. And just carrying on with some of our questions that, I wanted to find out a little bit more about this program. What are the benefits of this program being offered? And is it simple for older persons to register and get connected?
Yes, absolutely. So our intention was to make this as barrier-free as possible. So like I said, the program is free, and because all it requires is a phone, it can really happen from anywhere. So the onboarding is very simple. You want to collect, of course, people's interest and know what's going to entice them to the programs. But other than that, you get them on a call and you just build that relationship from there and get them to come back. So I really feel like the benefits of the program is really that creation of connection and safe space. I think when we think about older adults, we can talk about different groups within that larger category. I often think about our 2S LGBTQIA plus peoples who often, as they age and go into long-term care settings or retirement homes, often have to feel they go back into the closet.
Yes.
As don't feel safe and comfortable declaring their orientation. And so I think if we had a program exclusively for them, for example, we have that space where they can talk and feel safe and really connect about their unique needs and interests.
And they feel more comfortable, perhaps. I think we were talking, a while back about, sometimes people don't like going into larger groups, or if they're going into senior centers or community centers, they feel anxious. So these smaller groups, and this is what Mosaic brings as well. We don't have 100 people, big groups coming to our social programs. They're small and intimate. So the facilitators are building a relationship with the individuals coming into the group, and people feel much more connected and relaxed to open up a little bit. So I'm sure you're, finding that on your telephone calls as well.
So critical, yes. And another group that is really important with building connection is, of course, our newcomers. often they arrive, and especially amongst the older adult population, they might not only have health constraints, but they have a language barrier. They're somewhere new and isolated. So we actually currently have partners that offer Without Walls programs in 14 different languages and
That's
really
terrific.
cater to that community.
Yeah.
And one of those programs we see are, of course, speaking in their language, but talking about memories and their culture.
Yeah. Yeah.
So that can be a really powerful connector.
I think that's, really important, and trying to tap into those organizations. I guess, when somebody is coming into the country, they really don't know about the community agencies or perhaps, the groups that they can connect to. So yeah, it's hard, I think, trying to find that group, and okay, how do you promote that? Uh, so on to the next question about promoting. Given that SCWW caters to older adults, that might be isolated in the community. How do you promote this program? And especially as many older persons may not be connected to a community agency that we've spoken about, hospital, social worker, or government agency, which promotes such programs.
Yes, on our team, we call that promotion the secret sauce.
It is a secret sauce. Yeah. Yeah.
So I think where we've seen a lot of success is in building those relationships with other agencies that are also providing services and programs to older adults in the community. And thinking or remembering maybe that our promotions don't necessarily have to target older adults themselves, but there's a lot of power in targeting their friends or caregivers and loved ones. So some ways that we've done that, for example, one of our partners in Aurora, they give out business cards for their program. So they've given them to paramedics and they've given them to their mayor so that when they're at
Yes.
different events, they can give out that card. We've also seen, of course, social prescribing,
Yes.
which essentially, instead of just a medical prescription when an older adult goes to see their doctor, they actually get a prescription to an older adult community center in their community. And so when they go there, they're, greeted by someone who's going to help them navigate and find programs and services that are really going to resonate with them. I think that's really powerful. A few other things we've seen, of course, are really capitalizing on Meals on Wheels. They are really wonderful to connect with and give out our bookmarks and magnets to. And of course, when they're visiting and delivering those meals, they can actually promote the program. Other things we've seen is Facebook ads are actually really kind of low cost and effective. And those have been really powerful to recruit volunteers in particular, actually.
No, that's great. And I think, I'm in Toronto, I'm sure Ottawa's the same, there's a lot of the health fairs that are going on, especially now. Through the different community agencies and senior centers, like they're coming out of the woodwork every day. There's something. And I guess it's, before people are going away on holiday, is to get the information out and to the family members as well. So, and then also, you did mention about the family doctors, that's really important for them to, I think, know about the community agencies and, writing prescriptions, for their patients to connect to these wonderful programs within Canada or their own community. So thank you for that information. So I'm sure you have connected with many older persons who have attended your programs, and perhaps you may just have a couple of testimonials to share with us today.
Yeah, that's always my favorite part. The goosebump inducing part.
Yes.
Yes, so it's hard to choose just a couple, and I know we can't go on for hours here. So the few that have really resonated with me is a caregiver named Mary. And Mary's husband, Douglas, attends the program a couple of times a week. And Douglas is recently diagnosed with dementia. And Mary described to us that her typical, dinner table conversation is quite quiet. But on the days that Douglas goes to the program, it's lively and he's sharing, what he learned that day or little jokes. And it makes her so happy to see that he has that connection.
No, that's lovely because he's, being stimulated you know, that they're not going through each day the same. And just, I think, yeah, definitely that communication and connection to other people. Yeah, that's amazing. Yeah.
Absolutely. We also have another woman named Anna, who's an Indigenous woman, and throughout her life has faced many different hardships, you know, surviving World War II, and of course, discrimination for being Indigenous.
Yeah.
And so when she lost her husband of over 60 years, she dreaded each day and worried about getting through it. Now she says the calls give her something to look forward to.
Oh,
And she even participates in multiple programs per day.
that's
And when
terrific.
we spoke with her, she described the program as making her feel included, supported, and valued.
And I think that's really important for an individual who is feeling isolated and lonely to find, you know, such wonderful programs that they feel comfortable. And I think also the people of the programs make it as well. I know at Mosaic we have a wonderful group of people that come to our exercise programs, and they've built up relationships. And you know, what we found within our knitting group that have been going on for 14 years is now the ladies, you know, if they need somebody to help them, they call upon their group, or they're going to each other's places for, you know, different birthdays and lunches and dinners. So it builds connections almost like outside of that circle as well, that they continue that. So thank you for sharing those testimonials. If anyone is interested in learning how to either join or build an SCWW, Senior Center Without Walls program in their community, now how would they contact you to find out how to do this?
Yes, please get in touch with us. Yes, so once again, you can feel free to reach out to us over email. And our email is scwwconnect@thegoodcompanions.ca, or you're more than welcome to also visit our website, which again is tinyurl.com/scww partnership. And like I mentioned before, that has a full listing of SCWW programs, so you can find one in your area. And if there isn't one, hey, we can help you build one.
Aw, that's great, Adrienne. And I'd like to thank you for spending time with me and to our listeners on Mosaic's Community Life podcast, Life in Canada. And I hope that other provinces and community agencies will implement this type of wonderful program to keep people socially engaged and to have meaningful person-centered conversations. And at this time, I usually ask our guests if you would like to leave a takeaway message to our listeners. So, Adrienne, do you have a message you'd like to leave our listeners with?
Absolutely. Yes, I just want to encourage anyone that's listening that may know a friend or family or loved one that may benefit from a program like this, please reach out to us. This program has changed lives and has built friendships and connection and has absolutely reduced feelings of isolation and loneliness. So please get in touch. Like I said, we have our email and our website with all those listings of programs in your area, and we'd love to connect more.
And thank you for that. And we'll put, for our YouTube, we will put that information again on your contact information, so it'll let people know. And now, until our next Mosaic's Life in Canada podcast, this is Jane Teasdale signing off from Mosaic.